Menthol cigarettes are disproportionately used by black smokers, which is the direct consequence of decades of targeted advertising by the tobacco industry. However, the proposed FDA ban on menthol cigarettes, which aims to advance health equity and reduce racial disparities in tobacco use, is not the most effective method to achieve these goals. It has the potential to result in unintended consequences, and more importantly, it overlooks more effective alternatives that should be considered in lieu of or in addition to the proposed ban. Here we review some of these alternatives. My name is Amir Al Pasha, and I'm an assistant professor of medicine in the Division of General Internal Medicine here at Mayo Clinic in Rochester, Minnesota. We recently published a commentary titled Equitable Approaches to Menthol Tobacco Use Reduction, Rethinking a Blanket Ban, which will appear in the April 2023 edition of the Mayo Clinic Proceedings, Innovations, Quality, and Outcomes. In 2021, the FDA announced its intention to ban menthol-flavored cigarettes and all flavored cigars. This was followed in 2022 by the publication of the proposed rules, which has now completed its public comment period, and we are now awaiting publication of the finalized rules. In this commentary, we highlight our continued concerns with the ban. We propose alternative and complementary approaches to combat menthol-flavored tobacco products that can achieve many of the FDA's well-intentioned goals while avoiding unintended consequences of a ban. To be clear, although we have argued that the current proposed ban is a paternalistic government action mostly against a single racial minority group, we are not categorically against a menthol ban generally. Our first concern remains the potential for this ban to exacerbate racial disparities in the criminal justice system. Despite the FDA's reassurances that it does not intend to enforce the ban against individuals, the fact remains that the sale and distribution of banned cigarettes is a crime, and even if the FDA doesn't intend to take enforcement actions against individuals, other law enforcement agencies may and will. Such enforcement actions will disproportionately affect communities of color. Criminalization can and will transform a public health issue into a policing matter. History has shown that criminalization as a public health response usually leads to failures, as seen with the war on drugs and other examples. Prior to implementing a ban on menthol-flavored tobacco products, the federal and state governments should, at minimum, take appropriate steps to decriminalize the low-level sale and distribution of banned cigarettes. We also discussed some harm reduction strategies, including authorizing menthol-flavored electronic nicotine delivery system products, gradual reduction in menthol content over time in lieu of an outright ban, gradual increase in tobacco purchase age as done in New Zealand, combating tobacco industry advertising tactics, and investing in tobacco prevention and cessation. Lastly, we highlight the importance of community engagement. A menthol ban may eventually be part of an effective tobacco control policy in this country. However, that moment should only come when structural legal concerns have been addressed, other harm reduction strategies have been employed, and community engagement has been fully optimized. To implement a ban prematurely without a buy-in from the community is a top-down paternalistic approach that risks creating unintended consequences worse than what it aims to address.